all across America and around the world. This is Veterans Radio. This is Veterans Radio.
Good day. I'm Jim Fausone. I'm the officer of the deck today here on Veterans Radio, and thanks for joining us. We've got some interesting stories for you. We always want to remind you you can find more about Veterans Radio at its Facebook site or at the web, veteransradio.org, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.org. And before we get started, we want to thank our sponsors. First up, we want to thank National Veteran Business Development Council, nvbdc.org. It was established to certify both service-disabled and veteran-owned businesses. You'll find out how they can help your business by going to nvbdc.org. We want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. And finally, PuroClean. PuroClean is the paramedics of property damage. It provides water damage remediation, flood water removal, fire and smoke damage remediation, mold removal, biohazard cleanup. It also has a focus on veteran franchisees. You can learn more about them by going to puroclean.com. We just want to remind you that Veterans Radio podcasts are available on all your favorite streaming platforms, including rss.com, Apple Podcasts, Spotify, YouTube Podcasts, iHeartRadio, and Rees Across America Radio. So wherever you are, you can find us. We were recently identified as in the 15th spot, if you will, of the top 100 veteran-centric podcasts by FeedSpot. So we're really pretty proud of being in the top 15. So listen in wherever you're at to veteransradio.org and its podcasts.
We want to welcome to Veterans Radio today, Suzanne Gordon. She wrote a report that I saw that triggered my interest in this because there's a big policy debate going on about VA healthcare and how it should be delivered in the future. So Suzanne is an award-winning journalist and author. She's spent, I'm going to find out more, but I think she spent most of her career writing and researching in the healthcare area, all kinds of books and interesting things. And for about 8 years has been with the Veterans Healthcare Policy Institute. And that's where this report comes out of. Suzanne, welcome to Veterans Radio.
Thank you so much for having me. I'm so excited to be here.
Well, am I correct that you've spent a lot of your professional career kind of writing on healthcare topics?
Yes. I'd like to think about, I've spent really my whole life around kind of medicine and healthcare. My father was a famous ophthalmologist, and I'm almost 80, and I kind of just remember as a kid running around New York Hospital, Cornell Medical School, where he was. So I've been in touch with, medicine which is really not healthcare. So that's something we can talk about. And then I've been a journalist since 1971, and I've written 23 books, and most of my career, starting in about 1984-5, has been about writing about healthcare. And I would say I've spent a lot of time, maybe the last 15 years or more, either, initially focusing a bit on veterans healthcare in the VA, and then recently, basically all my time writing about healthcare and veterans. But the thing is that I think my many-year background in understanding healthcare and caregiving has really helped me understand the challenges of veterans healthcare, because sadly, the people in Congress and even many people in the media and in VSOs and so forth, don't really understand healthcare, or even medical treatment. And yet they proclaim and make all kinds of decisions, about systems that they really don't know anything about. And tragically, most of the people who, the secretaries of the VA, and we should talk about that because it's sort of interesting, don't know anything about healthcare, even though fundamentally all they do is run the biggest healthcare and benefit systems in the country.
Right. This is why I wanted to talk about it, is because the VA does operate, the government does have this biggest system in the country. And you mentioned Cornell. Let me back up a little bit. You have education both from Cornell University, Johns Hopkins University, and you've explained kind of why medicine was the start, journalism's here, and then healthcare. And there's a difference between medicine and healthcare. Tell folks what your thoughts are on that difference.
Yes, I'm so glad you asked me that. So, the Veterans Health Administration, I hope people understand, the Department of Veterans Affairs, which is the second largest agency in the federal government, runs with its, sub-agency, the Veterans Health Administration runs the Veterans Healthcare System, which is the largest healthcare system in America, the only coordinated healthcare system in America that delivers coordinated care. And I would argue the only actual healthcare system in America, because we really don't have healthcare systems in America. We have medical treatment systems that do a fairly bad job at even fragmented medical treatment. But healthcare is like way more than medicine. It's like what we call social determinants of health. It's like, what people eat and the air they breathe and their socioeconomic status, and which is super relevant to veterans, what occupations they've had, which is super duper, relevant to veterans. And in most American what passes for what they call healthcare, it's really medical treatment. And the VA, and I really mean this, the VA, for all its faults, and it could certainly be improved as any human system can, is really America's only healthcare system. The VA delivers, medical treatment, it delivers medical care, it delivers mental health care, but also deals with veterans, homelessness and veterans employment and veterans socioeconomic status and legal problems. And, tragically, and then, it has all these other missions, like, teaching playing a pivotal role in teaching Americans healthcare professionals in training, and being the, second biggest research powerhouse in the nation after the National Institutes of Health. And then, of course, there's also its fourth mission, which is, to respond to local, regional, and national emergencies, hurricanes, war, tornadoes, wildfires, etc. It's a really complicated system, and people don't get it. They don't get how important it is to all Americans, not just veterans. The VA teaches 70% of American physicians, most of American psychologists, huge numbers of American nurses. If you have
the research it's done, we've been talking to various people about the significant impact VA research does, and if you cut VA funding and cut that kind of basic research, the Million Veteran Project, which is delivering results because you have this huge pool of data that researchers can pile through and sort of begin to figure some things out. But you made an interesting comment I want to back up to, and we're going to get to the, honestly, veteran radio listeners, I'm going to get Suzanne Gordon to talk about her report and the policy issues, but you got to set this up a little bit. So you mentioned a minute ago how big this is and how broad the scope is, and that these secretaries of the VAs over time have, we've had a lot of disappointments and a couple of okay ones, but talk to us about your views. You've looked at, boy, who do we have running this thing, and that sort of message.
That's because the presidents and Congress really don't get what the VA is. It's the largest occupational healthcare system in the world, and it's one of the largest, it's probably the largest academic healthcare system in the country. And so it has affiliations with, runs a $9 million teaching programs. It has affiliations with 1,800 accredited healthcare professional programs. It's an academic health system. And, I think the problem is that, folks, and this is all presidents and sort of Congress and so forth, they look at the veteran and they say, oh, military, oh, who should we get to run something military? Let's find a general, or let's find, an admiral, or let's find somebody who was a military leader or was in the military.
But this is really a policy issue, right? This is when you talk about veterans health care and we hear all about, well, it'll just be grand to get all the veterans into community care and they're going to go to care in their local communities. And now we're back to sort of a congressional thing where I think you would say, these guys and gals in Congress don't know what they're talking about. So how did you start focusing in on what ultimately became, and I haven't read this title, I should have, the Veterans Healthcare Choice, Myth or Reality, a state-by-state reality check of the false promise of VA privatization?
So I started by, in 2014, spending 5 years researching a book called Wounds of War, where I went all over the country, interviewing veterans and hanging out with veterans in all kinds of appointments at the VA, and realizing, writing this book about VA healthcare. And I believe the kind of healthcare the VA delivers when it's fully funded and staffed and supported by Congress and, the administration, delivers the best healthcare in America. And that's not just my view, but it's documented in many studies. And so, one of the things that I really understood when I started really delving into the VA, and I really didn't understand this before. I was kind of like a lot of these folks making policy and a lot of the public. I didn't really understand how particular veteran patients are. And that's because the VA is really like an occupational health system. It deals with people who had a job that had a lot of risks and they had a lot of injuries and medical conditions and mental health conditions and, socioeconomic, consequences of their military service. And they are not like, the private sector patient. And unless you get that, deeply get that, you're going to think, oh, you can just send them across the street, assuming there's a place to send them to across the street. And if they have super different problems. They have some of the same problems as regular, as civilian people who never served, right? Problems of aging, problems of this, problems of that. But they also have these very specific military-related problems, and they actually can't get into care at the VHA if they don't have those problems and or low income, right? So that tells you, the minute you recognize that there are these different problems, then you say, oh, well, do the people caring for them know about those problems, recognize those problems, know how to treat those problems effectively? And of course, at the VHA, they do. Maybe they could improve, et cetera, because like 100% of their patients are veterans. Right? Every single person that walks into your office is going to be a veteran.
And they're going to have medical challenges, healthcare challenges unique to that job, as you mentioned.
Yes.
And I want to, you have some material in here on national statistics. And one of the things I kind of was a little taken aback by until I thought about it, I thought, well, that makes some sense to me. The veteran patient population is older, poorer, and sicker the non-VA patients. Talk a little bit about that and how that impacts things.
Well, I'm going to tell you the stats, and then I'm going to give you a really wonderful example of this. So basically, they are poor. I mean, I did an analysis of all 50 states, and whether there's enough private sector providers to handle an influx of 9 million nationally, or 1.5 million here, or 40,000 there. And I looked at every single state, right, the data on who makes up the veteran population. It was really fascinating. About 25% of veterans in any state have an annual personal income of 25,000 or less, and probably another 20-ish, give or take, have an annual income of 50,000 or less. And so it's probably 2020 or whatever, compared to 12% of the regular population. So they're poor, right? And between 2 and 6% of veterans in any state, give or take, have a personal annual income of over $200,000 compared to 12% of the American population. So they're, poor. When you're poor, you're sicker by definition, right? But then they have all these healthcare problems that come from military service. And those problems, you don't have to be deployed. You don't have to leave the continental United States to have those problems. So I'm going to give you 2 examples. Camp Lejeune, where they were poisoned, water, all kinds of, musculoskeletal injuries because of extreme exercise with carrying 70-pound packs. That's going to packs on your back. That's going to do a number on your knees, on your shoulders, on your ankles, etc., on your hips. Chronic pain, higher risk of suicide, military sexual trauma, PTSD. But I want to give you an example that I think really highlights. So the point of this is that they need, psychologists and oncologists and pulmonologists and primary care doctors, et cetera, who know where they served in the military and what the particular risks of that are, because otherwise they won't know how to treat these people. So I'm going to give you this great example. It's kind of horrible, but so Kyle Ann Hunter just told me about this. Kai is the new CEO of IAVA, and she was a pilot in Iraq and Afghanistan. And it turns out that pilots and aircrew have very specific occupational injuries and risks. And one of them is for certain kinds of cancer, prostate, and this thing called ocular melanoma. Have you ever heard of ocular melanoma? Okay. Well, neither have a lot of, some providers have heard of it, but they certainly don't know it's a risk for a pilot. So the minute in the VA that somebody was in an aircrew or a pilot, they get screened for ocular melanoma, which is like a super rare melanoma. We all know melanoma, your skin, you look for that weird mole, blah, blah, blah. Well, it turns out that ocular melanoma, which represents 5% of melanomas is super rare. And it's also has no symptoms as it grows in your eye. And it's kind of invisible. It's like way in there, right? You have to do special exam. Well, if you don't catch it early, so it makes it very scary, right? If you don't catch it early, you can lose your vision. You can lose vision, you can go blind, and you can die because it could spread, and it has a 5-year survival rate of 15%. So this is like very lethal, very rare and very lethal. Well, if she had been in the private sector, they caught it. She would have had this melanoma growing in her. God knows what would have happened to her.
Would never have looked. A private practice primary physician would never have asked, never looked, never understood.
No, and you're not going to get the kind of dilation eye exam. I'm not exactly sure what they do, but they do special exams, on a young person. But at the VA, it's like, oh, you're pilot. Hi, come here. We're going to. And so here's the thing. I don't think that the folks in Congress, I think there are people in Congress, sadly, who do not care, but I think there's others who just do not know. And so we are playing by sending many of these vets out to the private sector. We are playing Russian roulette with their lives. I think I'm alarmist because people should be alarmed. And so, the thing is, if you send people out to the private sector the way we're doing in the numbers we're doing, then you have to require that private sector providers, if there are enough of them, and we haven't even gotten to that issue, have the same extensive trainings in all these things that VA providers have. And the problem is that there aren't enough veterans in America. Veterans represent the people who are eligible for the VA, 9 million vets who are enrolled, represent not 3% of the American adult patient population. There will never be enough vets in any one person's practice to make it financially or even intellectually and professionally give the incentive for you as a doctor or a mental health professional or whatever to spend the hours and hours and hours and hours needed to know how to care for Jim or Joe or whoever, or Jean.
So Suzanne, because you just mentioned we haven't gotten there yet, and you're right. Let's talk about what your report, because you went, and this is the part that's really interesting, is you went, state by state, analyzed, does that state have enough capacity to actually absorb its veteran population, whether they could absorb it good or bad, right? We're now kind of talking about, well, they won't have the experience to absorb it well. But talk a little bit about your conclusions on it after looking at 50 states one by one, not as a broad scale. Could you even do this?
No, it's not possible. That's the problem. So even if you had a bazillion or, I don't know how many 785,000 doctors who are well-versed in veterans healthcare and, 2.2 million nurses and I don't know how many psychologists. Even if they, we don't have the right distribution and enough to take care of veterans. So essentially, you want to send these veterans into a healthcare system in the United States, which cannot deliver in many places the basic minimum care to its citizens in those states. The global picture, if you just want to talk globally, right? 89% of American counties have, severe shortages of primary care providers, right? And 79 million Americans, right? That's like 30% of the adult population live in where there's shortages of primary care providers and other physicians. In mental health, and we have to remember that, over 41% of veterans have a serious mental health condition. We have a major shortage of mental health providers. And as the former, head of Tom Insel, the former head of the National Institutes of Mental Health, he when he left, he said, we have like a mental health crisis in America that is so severe that it's almost like a social justice issue. And he reminded us that of the 78,000, 780,000 mental health professionals in America, very few of them are actually trained to deal with what are called serious mental illness, SMI, right? And veterans have a lot of serious, they don't just have like, oh, I'm worried about, this or that. or, oh my gosh, I'm a little anxious. They have like schizophrenia and, major depressive disorder and PTSD and combat related PTSD and military sexual trauma. I have a friend who went to a private sector mental health provider because there was a wait at the VA, and the private sector provider said, so what are you here for? And she said, well, this and that and MST. And the provider said, what's MST?
Yeah.
I mean, nobody, it's logical that
Rather than build up this need for services in VHA, in the last half a dozen years, the approach has sort of been, well, if we can't get to you in time, just go out to the private community thinking that solves it. Well, it doesn't. Your point is it doesn't solve it, first because there isn't capacity to do it. There isn't training to do it. I want to read one sentence out of your conclusion, which is, our survey of the current American healthcare landscape confirms that shifting more patients into the private sector is an unwise policy decision that will not fulfill the nation's promise to provide timely, high-quality care to the 9 million VA patients. This is a policy issue. Talk to us about what the audience for this report from the Veterans Healthcare Policy Institute, who's the audience?
Well, I'm always, when I write books or, I always am asked, oh, what's your niche audience? And I refuse to do that. It's like, I want everybody to read this. So my audience is folks like you. My audience is people in Congress. My audience is veteran service organizations. I want to get this, out to veterans, because like, if you buy the idea that you're getting more choices, think again, because like there aren't a lot of choices out there, maybe particularly if you're a rural veteran, 25% of veterans. And basically what's going to happen is you're going to be defunding the VA, which they're doing. Eventually, the American taxpayer is going to say, well, wait a minute, if nobody's using it, why should we pay for it? And then you're not going to have VA as a choice. And here's another thing, Jim, and you can relate to this. Another thing that really worries me, super, super worries me, in my long connection to vets, one of the things I see is that many veterans, when they leave the service, they do not immediately go to the VA. This is particularly true for mental health conditions, and pain and stuff like that, right?
Yes.
And then, 30 years later or 20 years later, their wife says, oh my God, enough with this, or you've got to go, or their buddy, or they retire and they have nothing to do and it all comes back to them. And then they go to the VA. Well, that means that the VA has to be there, not just for them folks now, but for when they finally get it in their heads, holy moly, I need help. So we need a VA, not just, now, but in 30 years.
We'll be there 30 years or 20 years more, yes.
Yeah, I mean, I have sat in on so many peer support groups for Vietnam vets. It's heart-wrenching stories of people who, for decades, literally decades, lived with anxiety and panic attacks and nightmares and blah, blah, blah. And they finally, 3 years ago, went to the VA and they're getting help. But so, we have to think not just like right now, we have to think longitudinally. People resist getting healthcare. They resist getting help.
I want a wide audience to look at this. That's my view on the audience. And don't get scared off because it's too thick. You need the first 10 pages. That's where it's all at, because then it's backed up by 50 more pages, state by state, what's going on. So you can read the 10 pages, kind of go, wow, I didn't think about some of these things. Let me go look at where I live and go to that state and say, oh, there is this shortage and that shortage of doctors or nurses or healthcare in my area. Because I do think there's been a push to sell to veterans and veteran service organizations that this community choice is the way to go. It may be a portion, it certainly can't be all. And I'll get in trouble if I don't, we didn't talk about it. I should have done it at the beginning. I'll get in trouble if I don't talk about, or have you talk about, what is the Veterans Healthcare Policy Institute?
Sure. Now, thank you for asking. So we're a group of veterans, journalists, researchers, people who work for the VA, and we formed what is really the kind of only think tank. We think a lot and research and write about veterans' health care issues, and we fight against the privatization of the VA. We believe, and this has always been true, that there is a role for private sector care. It used to be called fee-based care if the VA can't really do it, if they can't, get to you in a reasonable amount of time, or if they just don't have the service, like they don't have labor and delivery. I mean, it doesn't make sense. And so they pay for you to get it, in the private sector. But we are, proudly for public programs, and we want the VA, the Veterans Healthcare, the Veterans Health System to be expanded, to be improved, to work well. And we also want to remind people of, the fact that while it primarily serves veterans, it serves all Americans, and people I think a lot of people look at, VA healthcare, that's just for them. Why should I pay attention? I was one of those people before I started doing work and research on the VA. I thought, well, so they have this great innovation in care. What difference does it make? It's not going to impact me. I had absolutely no idea about VA research. I didn't know that my first shingles vaccine was thanks to the VA,
And that whoever you're getting healthcare treatment from probably did some training in their medical school and residency and fellowships at a VA hospital, because they train folks.
Right.
If you're interested, listeners, in the Veterans Healthcare Policy Institute, you can find it at veteranspolicy.org. That's where you can go, and there's a lot of good information there. And you can also track what Suzanne Gordon's doing, and titles of all her books and things, which is too long to read out loud, at SuzanneCGordon.com. Did I get that right?
Yeah.
Okay. Just realized there's a C in the middle of that, and I didn't or have it down earlier. So, as I say, you've spent the last decade or more working in this veterans healthcare space. Almost always when you're doing that kind of research and writing, you get that glimmer of, this is the next thing I got to chase down. So is there the next thing you feel you have to chase down?
Well, yeah, I mean, I think I really want to write some stuff to help people understand that the VA is an occupational health system. And, that means you have to know about the occupations that your patients, had, not just, after they left the military, but while they were in the military. And America doesn't do occupational medicine well, and it doesn't do healthcare well. So I want to write about that. I'm writing now a paper on the impact of the current VA policies and cuts on women veterans, which is significant and goes way beyond abortion services. The media has focused on that, but it's so much bigger than that. I don't know. I mean, I think we have this. I mean, fundamentally, I'm not a veteran, and I want the kind of care I think all Americans deserve, the kind of care that the VA gives when it's at its best and when it is supported by the public. And, and I think it's really sad that so many veterans don't really sort of appreciate this. And I guess the other thing that I really want to say to your audience, I suppose, is, I mean, what I feel is so tragic and sad is I know a lot of folks who work for the VA. I mean, they're psychologists, they're primary care docs, they're everything. And it's really sad to me to see how they're being attacked by, Congress, by the administration, these are people who could have worked somewhere else and made a whole lot more money. They're super smart. They know a lot, and they have devoted their lives, really because they're mission driven. And it makes me very sad to see VSOs and other groups not supporting them. Because, I mean, I know folks who are in tears. I mean, they are receiving, and veterans should be outraged that, the Trump administration is sending messages to their VA doctor and nurse telling them literally, you are not contributing to American prosperity, and you should do more productive, and this is a quote, work elsewhere. So what this administration is saying, taking care of veterans isn't productive work. If I were a vet, I mean, I'm outraged on behalf of vets. If I were a vet, I would be flipping out. I think we should flip out in appropriate ways and just be, going to these Congress people and saying, what are you saying here? Is that what you believe about the service I gave my country?
Well, I want to encourage people to find the Veterans Healthcare Policy Institute paper titled Veterans Healthcare Choice, Myth or Reality, a state-by-state reality check of the false promise of VA privatization. Suzanne Gordon, thank you for talking to us about this. It was very interesting reading and obviously a lot of work into it. And that's why I encourage people, go look at your particular state. It's going to reframe your thinking on this issue. Suzanne, thank you for talking to Veterans Radio.
Thank you for having me, Jim.
And I want to thank everybody for listening to Veterans Radio today. I am Jim Fausone. It's been a pleasure to be your host. I'm a veterans disability lawyer at Legal Help for Veterans, and you can reach us at 800-693-4800 or legalhelpforveterans.com on the web. You can follow Veterans Radio on Facebook and listen to its podcasts and internet radio shows by visiting us at veteransradio.org. That's veteransradio.org. We again want to thank our national sponsors, the National Veterans Business Development Council, nvbdc.org, Legal Help for Veterans, a veterans disability law firm with a national practice before the VA, can help you on your claims and your appeals. It can be reached at legalhelpforveterans.com or 1-800-693-4800. And PuroClean, a leader in property emergency services. It's the paramedics of property damage, providing water damage remediation, flood water removal, fire and smoke damage remediation, mold and biohazard cleanups. You can reach them at puroclean.com or 800-775-7876. We also want to thank our local sponsors. This would include the Charles S. Kettles chapter of the Vietnam Veterans of America, that's chapter 310, VFW Graf O'Hara Post 423, the American Legion Irwin Preskin Post 46 in Ann Arbor as well, the VA Ann Arbor Healthcare System, and certainly the National Vietnam Veterans of America Association. You can be a sponsor by going to veteransradio.org, clicking on the About Us and our sponsors, and help us out. Keep this program alive for the 21 and 22 years. Keep us going for another 20. Thank you.